Hey everyone, welcome to the channel. May is Mental Health Awareness Month, which is a profoundly important time to confront the realities of mental health, challenge pervasive stigma, and advocate for transformative systemic change. Today, we're embarking on an in-depth, roughly 15-minute long discussion about why mental health is a cornerstone of human well-being, the staggering scope of the global crisis, the systemic barriers that prevent access to care, actionable steps we can all take to make a difference in our communities, and practical strategies to prioritize our mental health and support those around us. This is a serious conversation touching on issues that affect millions of lives around the globe, and I invite you to stay with me as we explore this urgent topic with the depth and gravity it demands. Let's begin. Mental Health Awareness Month, established in 1949 by Mental Health America, is a dedicated period to raise awareness about mental health conditions, dismantle stigma, and promote equitable access to care. In the United States alone, over 50 million adults, 1 in 5, experience mental health conditions annually, including anxiety disorders, major depressive disorders, bipolar, schizophrenia, and PTSD. Globally, the World Health Organization estimates that almost a billion people live with a mental health condition, a figure that highlights the universal nature of this challenge. The roots of this month lie in the post-World War II era, a time when the mental health struggles of returning veterans exposed the inadequacies of existing care systems. In the 1940s, mental health treatment was largely confined to asylums, where patients were often subjected to inhumane practices such as lobotomies, insulin shock therapy, and prolonged isolation in overcrowded, underfunded facilities. These institutions prioritize containment over care, leaving many individuals without hope of recovery. Advocacy from organizations like the Mental Health America, which was then called the National Committee for Mental Health Hygiene, began to shift the narrative. The 40s and 50s saw growing calls for reform, fueled by exposés of asylum conditions and the introduction of new psychiatric medications, which offered alternatives to invasive treatments. The 60s brought deinstitutionalization, which was a movement to close asylums and integrate individuals into community-based care. While well-intentioned, this transition was poorly executed. Many people were released without adequate support, contributing to the challenges like homelessness and incarceration among those with mental health conditions. By the 1980s, Mental Health Awareness Month had evolved into a platform to address these gaps, advocating for better funding, research, and public education. Today, it serves as a powerful call to normalize conversations about mental health, affirm that struggling is not a sign of weakness, and push for policies that ensure care is accessible to all. It is a reminder that mental health is as critical as physical health. And seeking help is an act of courage. Mental health is the foundation of our ability to navigate regular everyday life, how we process emotions, build relationships, perform at work, and maintain physical well-being. When mental health is compromised, the effects ripple outward. Major depressive disorder can feel like a suffocating fog, draining energy and making even mundane tasks like brushing your teeth feel insurmountable. Generalized anxiety disorder can trap someone in a relentless cycle of worry where every decision feels like fraught with danger. Schizophrenia may distort reality, leading to isolation from loved ones, while PTSD can resurface trauma through nightmares or flashbacks, disrupting everyday life. In 2023, nearly 30% of US adults with mental health conditions, which is over 15 million people, reported that they could not access treatment to cost, provider shortages, or stigma. The consequences are devastating. Suicide is the second leading cause of death in the US, claiming millions of lives, with rates rising among youth and veterans. Let me share an example. For example, my friend David battled with depression for years, hiding it behind a cheerful facade at work. He'd laugh with colleagues, but at home, he'd collapse under the weight of despair, feeling like he was failing at life. He feared that admitting his struggles would cost him his job or respect, but when he finally sought therapy, it was transformative. He described it as learning to breathe again, but he regretted waiting so long due to shame. This story is not unique. Globally, the crisis is even more acute. The World Health Organization reports that low-income countries have less than one psychiatrist per 100,000 people, compared to 10 to 20 high-income nations. In conflict zones like Syria or South Sudan, trauma-related disorders are rampant, yet mental health services are virtually non-existent. In 2022, the WHO estimated that a global treatment gap of 70%, meaning 7 out of 10 people with mental health conditions receive no care. These numbers and stories underscore the urgency of mental health awareness and action. Systemic inequities are among the most formidable barriers to mental health care. In rural areas of the U.S., entire counties lack mental health providers, forcing residents to travel hours for a single appointment or forego care altogether. In 2021, over 60% of rural counties had no practicing psychiatrists. Even in urban areas, costs are a significant hurdle. A single therapy session can cost $150 without insurance, and even with coverage, high copays, deductibles, or limited session allowances create financial strain. In 2023, 25% of insured Americans reported skipping mental health care due to cost. Cultural stigma further complicates access. In many communities, mental health struggles are stigmatized as a personal failing, a lack of resilience, or even a spiritual deficiency. For instance, in some Asian communities, cultural values emphasizing family honor and emotional restraint can discourage open discussions about mental health, leading to silent suffering. Studies reveal stark disparities in care. Black and Hispanic Americans access mental health services at half the rate of white Americans, often due to systemic racism, mistrust in healthcare systems, or lack of culturally incompetent providers. For example, a 2020 study found that black patients were less likely to receive follow-up care after a mental health crisis due to biases in hospital discharge processes. Policy gaps exacerbate these issues. In 2022, U.S. states allocated just 5% of their health budgets due to mental health, despite its impact on 1 in 5 adults. Federally, the Mental Health Parity Act of 2008 mandates equal coverage for mental and physical health, but enforcement is inconsistent. Many insurers still limit mental health benefits. Globally, the WHO's Mental Health Atlas highlights a shortage of 4 million mental health workers, with low-income communities in countries having less than one psychologist per million people. Advocacy is essential to bridge these gaps. Policies that fund community mental health centers, expand telehealth, train diverse providers, and enforce parity laws are critical. Organizations like the National Alliance on Mental Illness and the World Health Organization are leading these efforts, but they need grassroots to drive change. Certain populations face disproportionate mental health challenges due to systemic inequalities, social pressures, or unique circumstances. And indigenous and people of color communities often experience race related stress, which compounds conditions like anxiety and depression. A study found that black Americans report higher rates of depression linked to experiences of systemic racism, such as workplace discrimination, microaggressions, or police violence. Indigenous communities face intergenerational trauma from historical abuses like forced displacement and residential schools, contributing to elevated rates of PTSD and substance use disorders. Hispanic individuals may encounter language barriers or immigration related stress, which exacerbate mental health challenges. LGBTQ plus individuals face significant risks. Over 40% of transgender adults have attempted suicide, according to the Trevor Project, often due to family rejection, societal prejudice, or lack of affirming care. Lesbian, gay, and bisexual youth are 3 times more likely to experience depression than their heterosexual peers. Rural residents struggle with access. Some areas have one therapist for thousands of people, if any. For example, in Montana, patients may have to drive 200 miles for a psychiatrist appointment. Youth are increasingly vulnerable. Teen suicide rates have risen 30% since 2000, driven by pressures like social media, academic expectations, and bullying. I recall a conversation that I had with my teenage cousin, who felt crushed by the curated perfection of Instagram, but I didn't know how to express her anxiety. After joining a school counseling group, she found tools to cope, but many teens lack such resources. Veterans face unique challenges. PTSD affects 20% of post 9/11 veterans, yet stigma in military culture often deter treatment. Low-income individuals are also at risk, as poverty amplifies stress and limits access to care. A study also found that 40% of low-income Americans with mental health conditions received no treatment due to cost. These groups need tailored solutions. A culturally competent care for BIPOC, affirming spaces for LGBTQ plus individuals, mobile illnesses for rural areas, school-based programs for youth and veteran-focused services. Addressing their needs requires listening to their lived experiences, amplifying their voices, and advocating for inclusive policies that address their specific barriers. So, how can we make a difference this month? Here are 7 actionable ways to get involved. Number 1, educate yourself. Dive into trusted resources like NAMI's website, which is nami.org, the World Health Organization's mental health reports, or books like The Body Keeps the Score by Bessel van der Kolk, or Maybe You Should Talk to Someone by Lori Gottlieb. Understanding conditions like OCD or borderline personality disorder can help you support others without judgment. Number 2, advocate for policy change. Support legislation that improves access to care. Visit Mental Health America's advocacy portal to find campaigns, sign petitions, or email your local representatives about funding mental health programs. Even a single letter or call can influence policy decisions. Number 3, foster open dialogue. Start conversations with friends, families, or coworkers. Ask, how are you really coping with everything? And listen without trying to fix it. I asked my friend about this, and it led to a raw discussion about their panic attacks. They later thanked me for creating a safe space to share. Support organizations. Donate to or volunteer with groups like Mental Health America, local crisis centers, or the 988 Suicide and Crisis Lifeline. A $10 donation can fund a hotline call that saves a life, and volunteering at a crisis center can provide direct support. Number 5. Ways awareness. Share facts, statistics, or resources on social media using hashtags like mental health awareness or hashtag mental health matters. Wearing a green ribbon, the symbol of mental health advocacy, can spark conversations. I wore one at a family reunion and it prompted my aunt to open up about her struggles with anxiety for the first time. Number 6. Participate in community events. Join NAMI walks, virtual webinars, or local support groups. These events build community and amplify advocacy. I attended a NAMI webinar last year and I learned about local resources, including a free counseling clinic I didn't even know existed. And number 7, learn crisis intervention. Take a mental health first aid course through NAMI or similar organizations. These courses teach you how to recognize signs of a mental health crisis and respond effectively, like knowing when to call 988 or connect someone to a professional. Taking care of your mental health is not a luxury, it's a necessity, as vital as eating or sleeping. Here are 6 evidence based strategies to support your well being. Seek professional support. If you're struggling, reach out to a therapist or counselor. Teletherapy platforms like BetterHelp, Talkspace, or community clinics offer affordable options. The 988 Suicide and Crisis Lifeline is available 24/7 for immediate support. Intervention can prevent early crisis. I sought counseling for burnout 2 years ago, and it gave me tools I still use today. Practice mindfulness. Techniques like meditation, deep breathing, or journaling reduce stress. Try this exercise. Inhale for 4 seconds, hold for 4, exhale for 4. Research from the American Psychological Association shows that 10 minutes of daily mindfulness can significantly lower anxiety and improve focus. Build a support network. Connect with people who listen without judgment. Support groups, whether online or in person, provide community. After my own struggles with stress, joining a local group gave me a sense of belonging and reminded me I wasn't alone. Set boundary health. Protect your energy by saying no to draining commitments. If work is overwhelming, negotiate deadlines or take mental health days. I started setting boundaries last year, turning off all my textings, and it reduced my stress immensely. Stay physically active. Exercise, like a 20-minute walk or yoga, boosts endorphins and improves mood. A 2020 study linked regular movement to a 25% reduction in depression symptoms. I found that a morning jog or just light exercise helps clear my mind and sets a positive tone for the day. And lastly, limit social media. Excessive social media use can increase anxiety and lower self-esteem, especially when your feed is nothing but depression. Set time limits. 30 minutes a day, maybe less, and curate your feed to avoid negative content. I cut my scrolling time in half last year, and it made me feel more present and less overwhelmed. Myths about mental health perpetuate stigma, and deter people from seeking help. Let's debunk some common ones. First, seeking therapy does not mean you are weak or broken. Just as you'd see a doctor for a fractured bone or a cardiologist for heart issues, mental health care is all about healing and growth. Second, mental health conditions are not all in your head or a matter of snapping out of it. Depression, for instance, involves measurable changes in brain chemistry, such as reduced serotonin or dopamine levels, and requires professional intervention. Third, you don't need a formal diagnosis to benefit from support. Everyone faces stress, grief, or anxiety at some point in their life, and counseling can help anyone navigate life's challenges. Fourth, mental health conditions are not rare. Nearly 1 in 5 adults and 1 in 6 youth experience them annually. Fifth, self care is not selfish or indulgent. Taking time to journal, rest, or go for a walk equips you to show up better for your family, friends, and work. Sixth, medication is not a cop out. For many, instant antidepressants or anti anxiety medications are life saving, just as insulin is for diabetes. I used to believe therapy was only for serious problems, but when I started seeing a counselor for everyday stress, it reshaped how I manage my well being. Dispelling these myths encourages more people to seek help without shame or fear of judgment. Mental health care varies dramatically across the globe, reflecting disparities in resources, culture, and policy. In low income countries, stigma and shortages leave millions without support. The WHO's Mental Health Atlas reports a global shortage of 4 million health workers, with some African nations having one psychiatrist for every million of people, which I stated a couple minutes before. In conflicts zones like Yemen or Ukraine, trauma-related disorders are widespread, yet mental health services are scarce. In contrast, countries like Australia have pioneered telehealth programs offering 24/7 counseling that reaches remote areas, while Denmark integrates mental health education into schools, reducing stigma early on in their life. These models offer lessons for global improvement, investing in telehealth, training community health workers, and prioritizing prevention. In the US, key resources like NAMI for education, support groups, and advocacy, the 988 Suicide and Crisis Lifeline for immediate 24/7 support, and Mental Health America for free screening tools and policy campaigns. The Substance Abuse and Mental Health Services Administration offers a treatment locator at findtreatment.gov. Globally, the WHO's mental health page lists regional hotlines and programs such as the Befrienders Worldwide Network for Crisis Support. Community engagement is vital. Events like NAMI walks, virtual webinars, or local support groups foster connection and amplify advocacy. Also, said this before, but I attended a NAMI walk 2 years ago and was deeply moved by the stories of resilience shared by participants, from survivors to caregivers. Online, platforms like Reddit r/mental health, with over 500,000 members, or Twitter posts with hashtag mental health matters, offer virtual communities where people share advice and encouragement. I encourage everyone watching this video to explore these resources, attend an event, or join an online discussion this month. Even small actions like following a mental health advocate on TikTok can broaden your perspective and inspire action. Mental Health Awareness Month is a call to action to listen, learn, educate, and advocate for a world where mental health is treated with the urgency and respect it deserves. If you or someone you know is struggling, please seek help. You are not alone, and resources are available. In the comments, share one step you'll take this month to support mental health, or let me know if you are suffering from a mental health disorder. I will do my best to respond to most of them. Whether it is starting a conversation, exploring a resource, or sharing your story, it helps. If this video resonated with you, share it with others and subscribe for more discussions on critical issues. Thank you for watching, and let's commit to making mental health a priority, not just in May, but every day of the year.